Hi, Assalamu alaikum. My name is Dr. Noman Bashir and you are watching my YouTube channel. Now our today's lecture will be on spay surgery in cat, that is also known as OVH. OVH stands for ovariohysterectomy. First of all, its overview. Spaying is a sterilization procedure that eliminates your cat's ability to go into heat and reproduce. Basically, spay is a surgery to eliminate the heat sign and reproduction and to stop the unwanted pregnancy. Then there are two types of sterilization techniques used by veterinarian: ovarectomy, removal of cat's ovaries, and ovariohysterectomy, removal of the ovaries and the uterus. In this, there are two concepts in which, first of all, cat's ovaries removed. Only in this, the focus will be only to remove the ovaries, and the other method in which we remove ovaries and the uterus. In this concept, there are lots of points under consideration to do either ovarectomy or either ovariohysterectomy, depending on the age of the patient, condition of the patient, its health. But after all, spay surgery has its benefits on the cat's life and its health. Now the next point is age for spay in cat. The recommended age for spay surgery in cat is 6 months old because it's the time when your cat has completed all the vaccination and is mature enough to undergo surgery and general anesthesia. As this is a surgical procedure, so general anesthesia is must. So body should be enough prepared to do herself to bear the general anesthesia procedure and surgery for spay, that is also known as soft tissue surgery. So patient body should enough be mature to bear the post-operative care of that surgery. So 6 month age is recommended for spay surgery. This point is also important because after the 6 month of age, cat get into the maturity phase in which their organ has been fully developed. So the spay surgery will be beneficial for that age. Now the next point is benefits of OVH, like quality of life. After spay surgery, our cat enjoy the quality of life because having no any aggressive behavior like that. Then inhibition of heat sign like vocalization. When a cat has been done with OVH surgery, then heat sign become eliminate and there will be no any behavioral changes like vocalization to find the male and heat sign like that. Then the most important thing is disease prevention. Most of the disease can be attack on the cat that are not spayed, like ovarian cancer, uterine cancer, pyometra, mastitis, mammary gland cancer. These are the major concerned diseases that can be attack on cat. But after getting OVH surgery, cat will enjoy the quality of life and will be free from these fatal diseases and will enjoy a good life in its future and will be calm and will become more docile to its owner. The next important point for spay surgery is patient health status. We will make sure the following points before doing the surgery. First of all, proper feeding pattern. We will make sure that she is getting her good food and having no any feeding behavioral changes like any type of vomiting or ulceration. So it should be very clear. Then no any clinical sign. That is also an important that if a cat has been showing any clinical sign like vomiting, respiratory issues, anything like high temperature, fever condition, then don't perform any type of surgeries, especially spay surgeries. Then prefer to be vaccinated. It's a very valid and preferred point for the spay surgery that cat should be fully vaccinated. And the other thing is blood panel required. Before doing the surgery, we will perform following main compulsory blood panel test like CBC, LFT, RFT to know the whole blood chemistry test and the liver functioning and the renal functioning, kidney functioning test, because it is very much important because the patient will be general anesthesia and many complications can be happen without any blood chemistry test. And before doing surgery, a cat should be 6 to 8 hours fasting because if there will be any type of feeding before the surgery, then during general anesthesia cat may vomit and can cause the complication, and then it is also against the ethics of medical procedure. So 6 to 8 hours fasting is required for the Spay surgery. Now at this there was a lecture. Now next will be video lecture on the Spay surgery in cats. Now we will perform Spay surgery on this cat named Coco, and she is under the general anesthesia. First of all, we will disinfect the area with the iodine scrub to disinfect all the area, that there should be no any type of debris or germs, and the area should be very clean and clear. That is also known as the prerequisites of surgery. Now the area has been fully cleaned and the cat is under the general anesthesia, and also administered with infusion therapy to maintain its fluid. Now the patient is ready for the Spay surgery. First of all, I will make the incision below the umbilicus. I made the incision of 1 inch. After incision, I will cut the fat layer. Then on the muscular layer, I will cut the linea alba. Then I will approach to the uterine horn, and first of all ligate the uterine artery. Then in the same way we will ligate both the ovarian arteries and remove the ovaries from the abdomen. Then ligate the body of the uterus and remove the uterus and the ovaries altogether. After that the suturing pattern will be started. Then the first of all suture the muscular layer with the simple continuous suture. Either someone can do the simple interrupted suture, depend on the veterinarian, depend on the doctor. So first of all suture the muscle layer. Then after this muscle the fat layer. Someone don't even suture this, but it depend upon the condition and depend on the veterinarian. Then suture the subcut layer. In this suture, if a proper subcut has been done, then there will be no need to stitch the skin from outside. So this will be a stitch-less surgery because I will do it subcut suture, not other the body. Now you can see that there is no any type of suture above the body, only internal suture was done. Now the surgery has been completed. After the surgery, the post-operative care is very much important for the Spay surgery. First of all, a cat should be administered with the e-collar. That after the Spay surgery, the incision site and the stitches can irritate her, and she can try to open the wound. So e-collar must be administered for cat after Spay surgery. Then at its home, dust or litter material should be very clear, not to irritate them, and even dust can increase the pathogenicity in the incision area. And when you are performing the dressing of the her wound, then you should be very clear that you are not applying any type of pressure on the abdominal surface. If there are other cats also at home, then the spayed cat should be separated till the healing of the stitches and till the healing of his wound. Because the post-operative care is very much important for the healing of any type of wound, and specifically in the Spay surgery, because it is the surgery related to soft tissue. So post-operative care lead to the success of the surgery. And I am very much thankful to all of you to watch my video. Kindly subscribe my channel, like the video and share with your friends, and put any type of comments if you have any type of queries related to Spay surgery. Thanks a lot. I am Dr. Noman Bashir.